Hi, and welcome to our quick overview of the Institute for Accountable Care Return on Investment Cost Benefit Assessment Tool for ACOs. This tool grew out of work in a high need, high cost learning collaborative, where many of our participating ACOs said that demonstrating return on investment was a key goal and objective for them. In the course of looking at tools for our learning collaborative participants, we found that there was not much out there that was designed specifically for ACOs. So we've taken the best in breed tools that we could find and adapted them specifically for the ACO context. By way of a little bit of background, we think it's very important that when you're building the business case or assessing ROI, you match the activities to the level of development of your program. So when your program is new as a pilot, you're going to want to put your efforts into understanding what are the costs of running this model. How do I optimize staffing? How do I optimize the use of resources and travel time? And so in that phase, you really want to be learning and understanding the costs. As you get more and more patients in the small scale sort of stage, you want to then begin shifting to understand the effects for patients. And you may look at your own patients, how have they changed over time, or build an internal comparison group. As your model gets more sophisticated, you can then sort of apply better methodological techniques to assess the effect size of your model in your exact program. And that is an opportunity to say, what impacts are we really having? What can we measure? So thinking about an ROI tool, there are three basic components. We're going to ask you to provide information on your operating costs. We're also going to ask you to select a savings amount, which is what I've been calling the effect size. And then the tool will do some calculations for you. And we'll show you the tool in 1 minute. So return on investment is the basic idea. Does the reimbursement, in this case for the services, exceed the cost of providing them? And that leads to an ROI ratio where positive numbers mean that there's a positive return and negative numbers are a loss. Cost benefit, on the other hand, takes a broader set of things into consideration and allows you to say, what are the indirect costs and benefits of this program model? And there may be things like increased patient satisfaction or employee burnout that are costs and benefits you want to take into account. Now, I'll turn to the Excel sheet in 1 second. But what I wanted to highlight is cells in green are places for you to enter information, and cells in gray are automatically calculated by the worksheet. So let's look at the tool. We start with the table of contents, and then this is the cost and revenue tab. In this tab, we ask you to begin by estimating how many patients you'll serve and how many visits per patient. Operating costs are often driven by staffing, and so this section asks you to estimate who will be involved in providing the care, what are their costs, what is their reimbursement, what can you get sort of reimbursed from Medicare for their services, and this is the only place where we ask you to put reimbursement information. The next section includes a space for administrative staff, then driving and mileage costs. Then we get into the variable costs, or things that increase as you do more visits, and fixed costs, things that you invest in to get your model up and running, but don't buy over and over again, like a computer. So the more time you spend thinking about all of the variable costs, such as supplies, brochures, tests, the more accurate this is, the more effective the tool is for you in estimating a cost benefit or return on investment. Similarly for fixed costs. Finally, there's an overhead section at the bottom. Some ACOs are nested in larger delivery systems, and you may or may not be allocated some of that overhead. The next tab is the offset tab, and this is where we ask you to estimate what do you think the savings per patient will be. And to do this, we've provided a lot of data from other studies of similar programs. And this tab focuses on home-based primary care. So we give you some mean estimates from groups of studies, but all of the details are included in this tab, which allows you to say, what were the beneficiaries targeted, what were the program elements, and what did these authors find as a loss or a savings. You can use this to inform your own guess about the savings or choose a number from one of these studies. Note that we rated these studies on quality. The higher quality studies are higher reliable results. We have a tab that's similar and is focused on paramedicine cost offsets. This is a space with less literature. You'll see there are only a couple of studies, but if this is what your model is all about or a component of your model, you'll want to put a savings in this box. This tab provides a space to estimate the impact on emergency department visits. So the earlier tabs were focused on total cost of care and inpatient stays, but this will allow you to add some targeted savings that you expect around ED visits. So you add the visit rate, the visit cost, and the expected change. The second panel in this tab is the place where we ask you to think about your ACO. And so we ask, what is your shared savings rate? So when you share your savings with Medicare, how much of that do you retain? And then what do you think the odds or chance are that you will receive savings in a given year? And this information is filtered through to the final calculation. The last tab where we ask you to enter information is the cost and benefit tab. Here is an opportunity you can change all of these fields and estimate opportunity costs, such as the cost of deploying staff to this model versus another program, employee burnout. We've made some guesses, but you should change these to meet your needs. Similarly, for additional benefits, you may improve patient mental health. You may have greater employee satisfaction. These do need to be estimated with dollar amounts, and we'll see why in a minute. The final tab is the tab that's calculated the return on investment. The upper panel is the ROI, and you get a summary on the total cost of your program model, as well as the cost per visit and the cost per patient. The return side is the reimbursements, and then all of this is combined to give you the ROI estimate, which in this case is positive but small. The cost-benefit ratio calculation is similar, but it takes into account any extra information you provided on this C and B tab. And when the cost-benefit ratio is above 1, the benefits exceed the cost, and when it's below 1, the costs are bigger than the benefits. The additional tabs in the tool provide you some information about how we built the estimated savings rates from the research literature. So just to wrap things up, I want to point out a couple strengths and weaknesses. So the strengths of our tool, we have tried to tailor this to the work of programs that are focused in the home sector. We focused on ACOs, and we feel like this tool is both a good planning tool. You can use this before you create your model, or an ROI tool to use with new programs. The challenges with this kind of tool, you have to be careful because you don't know necessarily the true effect size, so there is guessing involved. And obviously, the more patients and sophisticated your model becomes, the better you can get at estimating your own program impacts. And at the Institute, we're always excited to work with ACOs that want to estimate the effects of their programs, program evaluation. So we'd like to thank you for joining us today. If you have questions, please don't hesitate to reach out to me, Jennifer Perloff. I'm at the Institute for Accountable Care in Brandeis, and my colleague Sam Sobel from the Institute, and our contact information is here. Thank you very much.